I would actually love to start with your birth story because I don't think
Great.
people think about that. And
Yeah,
in my intake for people, I actually ask them about their birth. Like, was it traumatic? Like, did
let's start there.
what happened? So why don't we start from the very beginning?
Even though I was there, I don't remember, but I can tell you what I have learned from those who were there is that my exit from the birth canal was really problematic, mostly because I have a giant head. And so this was in the 70s, things were where they were at the time, but they thought I had encephalitis because my head was so big, and my head is still really big. And every show I've done, what I say is, this hat isn't going to fit me. And then the costumer says, no, it's an extra large, it's going to fit you. I'm like, no, it's not going to fit me. And then I put it on my head and it's like weirdly sitting on top. And they're like, oh my God, no, yeah, your head is huge. So it's just always been me. So it is just how I came into this world and how I still am.
Mhm.
And so it was really tough for me to get out of the birth canal. And something that you and I have talked about a lot in the coursework we've done is that sutures in the skull are different depending on the person. And we can see pictures from the French catacombs or from the um, bone graveyards where we see different skulls, and some of them look totally smooth where we don't see the sutures, and some of them we totally see the sutures very, very clearly. And my hypothesis is that that has to do with who responds well to craniosacral therapy,
Mhm.
because I have always responded great to it. So for years, I traded voice for craniosacral sessions on me, and I've always loved it. And my theory on why I love it is because it's the first trauma that I had well before I had any memories, and just essentially a compression feeling of like my head was really big, it wasn't fitting through the birth canal well, and I think re-expanding that area is very, very powerful for me.
Mhm.
And I think you said it well. Most people don't think about that because you can't really know, but you can certainly be curious about like how you came into the world and what kind of interactions in your body are useful for you. And I think that's why it works for me.
Yeah. So what did you notice how like what got better after you did craniosacral?
Well, so the feeling that I get is I'm a singing teacher, so the feeling that I get when I sing is more resonance in my skull. So I mentor a lot of teachers, and one of them said to me recently, she had her son's head was on her lap, and he was talking, and her hand was on the head. He was 4, and she was like, "Oh my God, his head is so resonant, like it's all vibrating." And she's touching her own head and going like, no, I don't feel any resonance there, because she also has had a lot of trauma in this area.
Mhm.
And so basically, tight structures don't vibrate in the body.
Mhm.
And so to think about what singing training is, and in my case, what kind of intake I do with a singer or teacher, is to think, are you actually getting vibration? Because maybe you've been through something that has compressed or damaged the pathway in some way, and now you're no longer resonating. So what I notice after doing that work is I just feel my voice better in my sinuses and my cranial and my facial bones, which is the feedback loop that you and I know is trigeminal nerve, which is controlling the sense of vibration among lots of other things and a lot of your skull and all your face. And that's looped in with the vagus nerve, which is controlling your voice, among many other things, for your homeostasis and who you are in the world. And so I notice a difference in that. And we know that there's connections in craniosacral between the dura, the surrounding membranes of the brain and the spinal cord, and the muscular system. They can get in and sort of bring those systems together. And that's why I really like that work. And I think if anyone's listening who's never done that, you at least should try it.
Yeah.
And your response is your response. You might do it and be like, I feel nothing. Or you
Mhm.
might be like me, where you're like, oh, I really can feel some change in flow. And I also get a sense of like I feel movement of things in my brain. And
Mhm.
one of the things in our training that I think was so cool is that we've done it for long enough, and our mentors are really good about keeping up with stuff. And around 2015, they were starting to discover that there's lymph in the brain.
Mhm.
So that glymphatic system, glial cells in the brain have a lymphatic element to them. And that's what I personally feel when I'm having it done. I feel a sense of flow
Yeah.
internally in my skull and my brain, that my assumption is that that has a lymphatic element to it.
Yes, that makes so much sense. And it's interesting because maybe that's not why you started doing cranial, right? Like,
Totally wasn't. I was just curious about it. I had a natural interest in it, just I think because of my background.
yeah. So that's pretty amazing that I think both of us have, like, when I would come to a session with you, I'd be like, so I feel like we should do something over here, or I feel like
Yeah.
we should work with this area over here, you know? And
And
I think that's,
yeah, we had like sort of a natural instinct of like this is where the work needs to happen.
yeah. And I think that many people do have that too, just
Yep.
like tapping into it is so important just to be curious, like, oh, what's going to happen if this happens? Not really expecting anything, maybe just
Yeah.
going for it. So, yeah.
Yeah, and I think that the value of a coaching relationship is it's a framework for your instincts. So what I hear constantly of the teachers that I mentor or take my certification course is that they say something like, I saw that, I had the instinct that that person had something going on with their tongue or their neck or their diaphragm or whatever, but I didn't know what to do. I just had the instinct and then it kind of didn't go anywhere because I didn't have a framework. I had the thought, but I didn't have the process. And so
Yeah.
I think that's what's so cool about what you and I both do is that it is essentially a process-based experience of taking someone, taking that instinct of going, there's something going on here, and then guiding them through concrete steps and an assessment process so that they have a way to hold on to that and a way to see change in their body.
Yeah. It's so awesome. And so with that being said, you also had something else going on from when you were little.
Yeah, so I had an inguinal hernia. So if those who don't know what that is, so hernia is basically things are spilling through the abdominal wall. If you're new to the hernia world, so there, the ab structure is very interesting. So from about your belt line up to the edge of your rib cage here, that is the area you have the most fortification because of the way the abdominal layers work. So briefly, there's external, internal oblique, a layer of that. Then your rectus abdominis, your six-pack muscle. There's another layer of internal oblique below that, and then all deep to all that is transversus abdominis. So you're very fortified in that middle area. And if any singers are watching, that's where breathing should have the most expansion between that costal margin, it's called, and the arcuate line, which is around your belt line of your pants.
Mhm.
Below that, you're not so fortified because the rectus abdominis dives deep to all those other muscles. And then there's a vulnerable area off to the side called Hasselbalch's triangle. And that is where my hernia happened. And I was way too young, or, couldn't understand what was happening for me at the time. But I have a huge scar on my left pelvic area, a horizontal line across there, which you have seen and worked on many times. And so it's something that I didn't rehab it. I was 4. I looked like I could move okay. It didn't seem like it was any big deal. And no, I went to school for singing. No voice teacher ever asked me about my history with it. No one ever thought, oh, maybe that's the thing. But my college teacher, who was what I'm describing, she didn't know about the body much, but she had great instincts. They had opened a Pilates studio in my school, and this was in the 90s in Michigan. So a Pilates reformer studio was like, wait, what? We were all like, what is Pilates at the time? Wasn't really a thing back then.
Yeah.
But they opened it because I went to a really great music school. And she had this instinct. She's like, you really should go do that. I just feel like you should go explore that. And I, before that, was having terrible performance anxiety. So I would get on stage and I would shake and think I was going to puke and couldn't perform at all to the level of it, what I knew I could do as a singer. And I started doing Pilates and I stopped being nervous. And that was the first thing that made me very interested in the body. And so that was about 30 plus years ago now. So since then, I've been studying the kind of stuff that you and I do, working with athletics and now neuroscience, but the idea of there's something to take back to performers from that work. And because I had such a visceral experience of changing my sense of fight or flight, of sympathetic nervous system, just through doing Pilates, because I couldn't feel my abs. I just had no map of that.
Mhm.
And we have tested together pretty much every body system over our long coaching relationship.
Mhm.
And it kind of always comes back to that for me. And it
Mhm.
still does. I did a new assessment this past week with someone on diaphragms of the body, and it's still the same area for me. So it's
Mhm.
just that's just an area that, for whatever reason, everything kind of coalesced around there. and my whole system moves better when I do something correct for that area, and my whole system moves worse when I don't. So it's for me very consistent and very targeted into that. And I assume I just had that at a time developmentally when it was just really locked into my particular nervous system. And I will, I think, always have to work with that area, but at least I understand the mechanics of that now and know what to do about it. And I was in chronic pain for a long time and haven't been in chronic pain for 20 years now. And I think a lot of that has come from better maps of that particular area for me.
Yeah, that's so interesting that you were able to piece together before you really knew anything about it that Pilates was helping you with anxiety and stage fright and all that kind of stuff.
Yeah.
Because if you weren't curious about it, you might have just said, oh, I need to like just get over it, or I need to just like loosen up, or I don't know what people at that time maybe told people to do about performance anxiety, right?
Yeah.
Like practice more, just like get on there and get over it. But that's really fascinating. So
I think this gets into our mutual friend Corinne Gibbons and what she says about music and intuition. So she has a wonderful audiobook called 10 Reasons That Singing is Freedom. And in that book, she explains how music and the arts can work with intuition, and specifically singing, because singing is the vagus nerve. The motor element of the vagus nerve is your larynx and your throat, your pharynx. And so there's the vagus nerve is the anatomy of your intuition. It's the anatomy of what you should do, where you should go, all those things. And so it's not the only way to do it through singing, but it's something that it's good to know that that nerve has this direct connection into the insular cortex, into the part of our brain that is our why, like why are we here? What are we doing? And so I think part of it was just that I have been and was surrounded by music from a very young age. I grew up in a music family. I think that helped me to be able to draw those parallels, just to notice it, because a lot of things are always happening in our life and we can only pay attention to so much. So I
yeah,
think having some kind of practice, whether that is meditation or music or something like that, to help you draw those connections so that you don't miss the signals, you don't miss the map of where you need to go. And I I do remember very clearly that correlation, and I think it influenced the rest of my life.
yeah, that's awesome. And right now, can you tell us what exercises or drills are helpful for that area that you're working on now? Because it changes, right? So you're not always doing the same thing. Like we've
Correct.
been through multiple things that you were
Yeah,
doing.
so we need novelty, because if we do the exact same thing all the time, the brain gets bored and then things don't change anymore. So yeah, so what I'm doing right now is similar stuff. So I always need to work on hip rotation. So I like to challenge that in various ways. Through our company Z Health, we get a discount in something called stick mobility. So they're wonderful sticks that have a sort of a flex to them, and they're really great novelty. They have a wonderful online platform on YouTube with tons of workouts. Uh, and they're some of the people who biomechanically, I feel like, really have it together. And when I listen to them talk, I'm like, yeah, that sounds right. And I think they give good advice. So I've been doing a lot of their workouts, and simple things like they're just poles, but just by pushing into the ground, I feel my center, I feel my midline, my core musculature activating, even just that test well. And then doing stuff like really detailed lunge, squat, deadlift work with these poles, because that gives me the connection of my abs to my hip complex,
Mhm.
which for me on the left is the most important thing to work on. So just simple things like a really well done lunge, but with some ab engagement through these sticks is what I've been working on mostly recently. And then continuing to work through coursework on body systems and chains, to go being curious about connections across the spine, same side. So stuff like, if I'm going to do my glute on my left and do my lat on my right, what does that do? What's that versus a unilateral lat on left, glute on left? Those are the kind of things I've been working through recently.
Cool. And I remember also there was a time you had gotten a concussion. Just
Yeah.
speaking of like things that are related, kind of like, oh, we need to do this to work on this or whatever. And your tongue started to swell up after that, right? Like
Right.
randomly, or did
Yeah,
you find
randomly.
out why it was working, why it was doing that?
Yeah. So yeah, that's a good story to tell. So I have two concussions in my history. They're both on my left side. So one of them, I was in a show, a show called The Secret Garden. I was the lead role, and so I was in the middle. I had just finished the big song at the end of the show. As a blackout, and a gilded painting fell on my head right here in a blackout. So I didn't even know what had happened, but I finished the show apparently with like saw stars, the whole thing.
Oh my God.
My second concussion was right here, and that was my own stupid fault because I was in a hotel room and I thought I knew I got to pee and thought I knew where I was, and I actually walked into the corner of a wall.
Mm.
Um, so that one, a little bit after that, I started to get tongue swelling on my left side of my tongue. And so just quickly in terms of the nerves, so the trigeminal nerve, it's all the three Geminis, three twins, forehead, cheek, jaw. And so the sensation in the front half to two-thirds of your tongue is the trigeminal nerve. So I was getting swelling along the trigeminal distribution on my left. And this was very early in my time around neuroscience. I was still figuring it all out. So I went the traditional medical route. I went to my ENT, who was like, maybe you have some kind of infection. So I did all these rinses and all that stuff, made no difference whatsoever. I went to a normal doctor who was like, I have no idea why that's happening. It would swell so much that I couldn't say an S or an SH. It would like affect my diction. Obviously, it was bad for me as a teacher. And so we were in a class together shortly after this had started happening, and the professor was talking about teeth and saying, well, you know, every tooth has a branch of the trigeminal nerve in it. And so as he was saying this, my tongue was starting to swell in the class. And so then we were doing the exercise, and in this case, I was in the left maxillary, the top teeth.
Uh,
We were doing this like twist your tooth, move it, and my tongue went and completely unswelled to the point where I actually laughed when it happened. I was like, oh, all I do is wiggle my tooth, where I'm going to all these doctors being like, help me with my tongue. Do I have cancer? Like, what is this? I literally
right.
went like that, my tongue completely deswelled. And then for like a couple months after that, I could feel the trigeminal, the like histamine kind of response in there. I'd feel it. I would just go, whoop, and it would stop, boop, stop. After about 2 or 3 months of that, totally went away, never came back. This was over 12 years ago. I've never had any kind of recurrence of it.
Yeah.
Uh, so it clearly was just my brain had interpreted this right here as something that was very threatening. And it's already on the side that had other history on. So it just somehow tripped over some kind of, it went over the line somehow
Yeah.
internally. And that was the way it exhibited for me. Fight, flight, or freeze. Things are trying to basically keep you safe by stopping you from moving. So one good way to do that would be to swell up your tongue.
Yeah.
So yeah, I did that for a little bit and it solved it. And I think it's interesting from my perspective because I've heard from hundreds of singers about, well, my dentist or my orthodontist or whomever says, well, this can't possibly affect my voice because it's not on my vocal folds. And I would say, well, yeah, it's not on your vocal folds, but do they know how the trigeminal nerve works? Because one of the nuclei of your trigeminal nerve is called of your vagus nerve, sorry, is called your spinal trigeminal nucleus. So the vagus nerve and the trigeminal nerve are like, and so if you have a problem in your tooth, which is the trigeminal nerve, could that be affecting vagal function? And not only do I think that's theoretically possible, I have tons of examples of that being possible and actually working with singers in the field. So
Yeah.
I think it's good to know that like even stuff like your dental history is relevant for anything you're working through in your body, not just singing. And it's something to consider the power of teeth because it's how you get calories, it's how you stay alive.
Mhm.
And so if there's problems there, it can have a huge impact on larger systems.
Yeah. When you were telling that story and how you touched your tooth and then your tongue just deswelled, I was thinking about Hogwarts and like Harry Potter. I'm like, did you go study like magic or something? But
It
anyway,
feels
I was
like that, right? Yeah, yeah. That's why it was funny because I was like, all I have to do is wiggle my tooth.
yeah.
Okay, I mean, sure.
But did anything happen to that specific twos, or it was just like that we were lucky that we were testing all of
Yeah,
them?
I think I mean no, and it wasn't that. That's not even the branch where the impact was. It was in the ophthalmic branch, the forehead, but it clearly registered into my maxillary branch somehow, and just didn't notice until I was playing around with that. So
Yeah, that's really fascinating.
yeah,
And what's even more fascinating and interesting to me too is that um, you have such a good interoceptive map, right? So that's how you were able to kind of put two and two together and
yeah.
be like, yes, this could affect this, or I can actually feel my tongue swelling. I need to do this. Now I feel it going down. And can you maybe talk about how important that is to and how helpful that is for people who want to be better singers, or maybe like, why am I practicing so much? Why am I doing all this and I'm not getting the results that I want, or I'm not where I want to be, you know?
Yeah, of course. So a question I get asked a lot is, what do I see the differences to be in the folks I work with who are at the top of their field? Like what do I see is different about their session with me? And the best thing I can tell you is that the difference is they have a really good interoceptive map. And just to define interoception quickly, it's your awareness of your internal body state, emotional awareness, but also just physical awareness. Can I feel how I'm doing? It's different than proprioception, meaning like, where am I in space? So if you're like choreographed to have your hand back there and you can tell where that is looking at it, that's proprioceptive system. Interoceptive is more, can I tell what the effect of something was in my body? Can I tell what I need in the moment? Do I know what kind of interaction I need? And I think that high level athletics, high level performing does train that in people. But I also think there is I think fostering that even in earlier stages of trying to be a professional performer is really, really important. And what I see, how I know that's happening, is that in a session, there will be changes in someone's voice. And I will usually verbally and sort of just by my reaction show when it's in the right place. So when someone does something and it goes well, that person can tell based on my reaction to what they did that happened. But what I listen for is not just, oh, yeah, okay. I listen for them to say, yeah, and I could tell because I felt this in my body. And I was working with someone just this morning who is a high level performer. And I said, we had that experience where we did a drill and it locked in where it needed to be. And I said, how did you experience that? I said, I actually felt the ground. I felt the floor underneath me when I did the correct rep. And these level of performers they have a map. They have a way to know what's going on, and they can correlate the external feedback from someone like me, from their coach, with their internal experience. And that person today left the session going, I'm ready to do this big performance this weekend. Like, you made me feel ready essentially by giving me that exteroceptive, the outside feedback, and it matched my interoceptive experience. And then the confidence goes, and then they can go on stage and really do it. And so what I think is relevant about that conversation is to think about how you are getting your sense of, is something going well? And if your only metric is, well, my teacher said it was good, or someone online said it was good, or whatever, that's not probably enough. You need some kind of practice to actually feel what's going on with yourself. And that's where it could be like a mindfulness practice. It could be just having a more dedicated practice for your own singing in this case. And maybe you record yourself to go, did my internal experience of what that was like in the session match my external experience when I listened back to it? Because there often is like a bit of a shame thing around hearing stuff back. I
Yeah.
present a lot of times in big rooms with a lot of people. And one of the questions I usually ask is, who loves to watch themselves back or listen back on video or audio?
Yeah.
And I would say average, I see maybe 20 to 30% of hands come up.
Mhm.
Sometimes it's like 2% of hands come up.
Mhm.
And I also kind of keep track of what the population in the room is. When I'm presenting for higher level folks, I will see the percentage around 50, 60%.
Huh, interesting.
It's pushing through that shock or that shame around like, oh, I don't want it to sound bad or look bad or whatever.
Yeah.
And that actually stops you from getting the loop because you need to have that loop. Did my internal experience match the external product that I created in that moment? And it's okay if it didn't. It just means you have to do more of that, that creating that loop so that your progress gets better. And
Mhm.
that's the main thing that I think is standing in people's way.
Yes, and that's also interesting to me because you were my first ever voice teacher.
True. Yes, I was.
And I remember my first lesson very clearly. And I wish I had my CD. I couldn't find it.
Oh man, yeah, we were making CDs back then. So
Yeah,
how long ago it was.
I really wish I could find it, but I remember I don't, at that point, I don't think I had the internal feedback yet for singing at all.
Right.
Um, and I think I got really lucky in the sense that you were my teacher because you were extremely patient with me. You were non-judgmental. So I knew I wasn't singing good, let's say, but I also knew that you weren't making me feel bad about it.
Right.
You were kind of like, okay, um, listen to this, try it at this or whatever. And then, okay, try this and then sing again. And I think I was developing like, okay, I can do it. Andrew knows how to teach me how to do it. And I didn't want to come back at first because it was
Yeah.
so horrible, actually.
Very,
Like,
yeah.
yeah, it was really horrible in the sense it wasn't horrible because I had a good time and you
Oh,
were
I know
you
what
were
you mean.
great. But it was
Look.
really uncomfortable and hard. But then I thought, this person really knows how to teach me how to do it.
Yeah.
And I feel like that might be what is really like when people maybe first started singing, they didn't get an Andrew as their voice teacher, right? Maybe
Yeah.
they had someone who was like, that was terrible, or, blah, blah, blah. And because they wanted to be a singer, they kept going. Like I didn't really want to be a singer, so I probably would have just never gone back.
Yeah.
But how does that affect, like that has a big effect on someone and whether they want to like, right, like
It's
watch
huge.
themselves on tape or how they respond to themselves on tape.
Yeah.
I mean,
So yeah, I mean it's huge. And of course, this is why it's so vulnerable to go to a voice lesson. Like very specifically compared to lots of other kinds of interactions, it's a very vulnerable thing to do because of the vagus nerve. So to quickly talk through the anatomy, we said the vagus nerve is feeding into this insular cortex. So when you use your singing muscles, you are using a different branch of the vagus nerve that most people don't use. So if I talk to you like this all day, this is called my recurrent laryngeal nerve that I'm talking to you on. But then as you listen to me speak like this, I'm using something that's called my superior laryngeal nerve coming down from the top into the larynx, and it's innervating, it's feeding a muscle that's called the cricothyroid muscle. And that's creating a stretch of the vocal folds, an elongation, which is what a sung quality is. So how we differentiate, I'm talking to you, I'm singing to you, is to have that muscle turn on. And
mhm,
so you're activating a branch of the vagus nerve that you either never activate or at least rarely activate, and then you're putting it under that kind of load. That is feeding into your insula, which is your whole purpose of like, why are you here on earth? What are you doing? And if someone shuts that down and tramples on that, it's it's traumatic because that's like about our purpose. It's something that's like way deeper than just like I want to hit a tennis ball or something. It's getting into very emotional territory,
mhm,
which is why the training for singing teachers, in my view, where there needs to be a lot of study of the brain, because I really think that improves empathy for what someone is going through as they walk into you. Just to tell a quick story from last week. So I run a certification program, and my level 2 certification gets into a lot of vision stuff. And so we were using Stephen Nedarazic, who is the pommel horse guy from the Olympics. We're using him as an example because he has a couple things interesting with his eyes. He has something called strabismus, which is like his eyes don't line up. technically called alternating esotropia. He can take one eye on, other eye on, like that. And then he also has coloboma, which means that he has a defect in his iris that's letting tons of light into his eye. And so we were talking about it. And then one of the students in the class said that what she said, when that was going on, I was texting with my friend who was like, why is he asleep? Why is he closing his eyes? Like, so disrespectful. Why is he doing that? And she didn't know any of that about his vision. So when in class, I was like, well, he was closing his eyes because he has coloboma and he's getting, think of how bright an Olympic gymnastics stadium is. He's doing that because he's overwhelmed by the light, and he's wearing his glasses till the end because they're helping him stabilize his vision. And I said, did you see how he closed his eyes before he got on the pommel horse? He's trying to avoid this like huge amount of light coming in. And then my student was like, I'm going to text my friend after on this lunch break. I'm going to be like, well, did you know this about him? Because it's like there's this sort of judgment that can come when we don't have the understanding of the brain. And what I was saying to the class when that came up is studying the brain is actually a study in empathy. It's a study in every human is trying to survive in all times in the present moment. The brain doesn't care about whether you're alive in 10 years or even 10 minutes. It cares that you're alive right now. And so it's going to hold on to your habits and try to keep you safe. And I think having that study and having that experience again and again with people in a vulnerable space like a voice lesson helps you improve your empathy as a person. And to say you don't have to be doing it well or, to be really good when you come in. Why would you be? Like, that's not something you've ever done before. And I can say, to brag on you, you got very good as we went over it over years, to the point where you're writing music, you're singing in all these different styles and ranges. Like you, to be cheesy about it, you blossomed. I mean, you really, really came into your own that way. And now you're singing in a choir that's like all this classical music. I mean, it's a huge success story to think about how that happened. And for those of us who are coaches, to be like, it's a high calling to take someone in and give them a good experience with something that we know is very threatening. Even if it's as simple as not singing, but just anything that brings up threat for you, your ability to modulate that person's nervous system is a real art, and something that I do think studying neuroscience helps with.
Yes, I think you said that so well. Like coaching, when you're working with a person, it is it can be such a life-changing experience for that
Yes.
person, and not to take it lightly,
Yes.
and not to and to really feel that it's like a gift that someone is allowing you to help them with whatever it is that they're working on. There's absolutely no way that I would have been able to do this choir if I hadn't studied with you for 10 years. And I didn't know that I was going to want to join a choir, 10 years ago. But I did have this like intuition that I think that my life would be richer and probably more full in many ways if I could learn to sing and feel comfortable singing. You know what I mean?
And
So
it's a
thank you.
testament. Well, you're welcome. I mean, it's very emotional for me to hear that you're doing that, because it's a testament to not just our work, but to you as a person to go, I love music now and feel confident in music enough that I can join something that this happens to the choir that you're in happens to be my old job. So I know that it's a very high level choir with very hard music. And the fact that you were undaunted and like, I'm going to go do that, it really speaks well. And it does explain how it can be life changing. And the thing I want to share with any coaches watching this is that is why I say always when I present, everyone needs a coach. You've been my coach for years and years. And we need that, because as a coach, we need to take care of our own fuel levels. What causes problems for coaches is not usually, I don't want to care for the person in front of me. Usually those of us who are going into this already want that. The problem is that if our fuel levels get off, we can't keep it together for the person that we're working with. So it's not only a high calling for you to do it, but it's a high calling for you to keep your own skills up if you are doing it, because the frontal lobe gets fed last. So the frontal lobe is inhibiting all those primal emotions. And if your fuel levels suck, you start to lose control of the experience. And I was taking some feedback on my course last week, and one of the students said to me, the thing that's most impressive about it is the evenness of your fuel level over a 6 hour class. That she said you never seem different at the beginning and the end, which I took as a high compliment because I don't
Yeah.
think that's everybody. And it's been a really conscious thing that I've developed over the many, many hours of training that you and I have done individually together and also in coursework,
Yeah.
to be like, we have to hold ourselves to a high standard of taking care of our own fuel, because it's never coming from like we don't want to support the person. It's coming because we don't quite have it together ourselves. And then things start to go awry, and that can really affect someone's experience to the point where it could, in my case, dissuade them from coming back to a singing lesson, not just with me, but period.
Yeah.
And that's such a, it's my commitment to myself to say I never want to be the reason someone stopped studying voice. I want to always make that something that's a joyous thing in their life. And even if they don't want to work with me, at least I don't want to have it be something where I have soured them on the experience. So I have to make sure that my own training is very diligent and very regular to keep that up.
Yes, absolutely. Do you have any like last thoughts or like encouraging words for someone who wants to improve their singing, like wants to improve, like you mentioned that having good interoception
Yeah.
is helpful. So like what could be some ways to do that?
Of course, yeah. Well, firstly, my encouraging words are something that our mentor, Dr. Cobb, says. It's like the science of hope. This whole view of life is, yes, it's science-based. Yes, I read a lot of studies and love to do that. But the reason I'm reading the studies is because I have had firsthand experience, both in my own body and in countless bodies that I've worked for, where something that seems like such a huge impediment goes away. We actually move through that. And the definition of pain that I use in my course is anything that stops you from doing the thing in life you love. So I
Mhm.
don't think it has to be physical pain. It can be, pain is a lot of things. It could be
Yeah.
emotional pain. Like I just don't feel like I can get where I want to get in my life.
Mhm.
And the great thing about what we do as a community in the functional applied neuroscience world is that we are providing a path that it is scientific and is based on tons of research, but also is inherently hopeful because things can change. And we know that your brain can and will change until the day you die. We say that neuroplasticity isn't good or bad, it just is. So
Mhm.
there are changes. And so I think what's very hopeful on almost a DNA level is that whatever's happening today doesn't have to be happening tomorrow. You just need to have the correct path through it. And if you are listening to this as a singer, the best thing about being a singer is your voice will never lie to you. It tells you the truth 100% of the time. It is a reflexive action. It is not a consciously controlled thing, which is frankly why you want to do it if you do want to be a singer. It is giving over to a reflex that feels revealing of human nature, that feels beyond our comprehension and full understanding. And it's never, ever going away in our culture or in any culture. And so that idea is so powerful to go, oh, my voice will actually show me exactly what's happening in real time. And practicing your voice is supposed to be the most fun part of your week, of your month, of your life. It is endlessly interesting because it will just tell you the truth. And if you want ways to do that, obviously I have a book on this topic. Many people have wonderful materials out there where you can just have someone guide you through it to go, I'm going to guide you through, here's a diaphragm exercise. What did that do? Here's a tongue exercise. What did that do? Jaw, etc. That is an endlessly fascinating process. And so if you're serious about improving your voice, really all you need is curiosity and some kind of structure around it. That's what's going to get you there.
Yep, I was going to say it sounds like you're saying be curious and keep exploring and experimenting and see what did that do? What did that do? My voice will tell me if it was helpful or not helpful or neutral, right?
That's right.
So,
It will tell you, did that suck? Was that amazing? Or did nothing change? It's going to tell you one of those three things. And if you keep track of that over time, a picture starts to emerge for you of, oh, this is what my training needs to look like, which is individual to you and will be different than what anyone else's training looks like. It is your nervous system, your voice, your body which needs its own specific things. And that is why I love the process, why I get up. I'm 31 years into a professional voice teaching career. I get up every day wanting to do it because I love how interesting and varied humans are.
Yes, I love that. Thank you so much for
You're
sharing
welcome.
your
Great.
story. I That was so fun, and I loved hearing all your stories. I actually didn't know that you had huge performance anxiety. I
Oh
never
yeah,
I never
totally.
knew
Yeah,
that.
I sure
So
did.
thanks for sharing all that.
You're welcome.